Welcome to Parish and Community. My guest today is President and CEO of Casa de Salud, Diego Abente. Thank you for joining me today, Diego.
Thank you so much for having me.
So tell me what the mission is of Casa de Salud.
So CASA's mission is to facilitate and deliver access to high quality clinical and behavioral health care for our region's under and uninsured. And we have a special focus on immigrants and refugees who, because of their cultural and linguistic challenges, experience barriers to receiving this type of care from other organizations in the region.
So is it just, you said, with a special focus, so others who are uninsured from other populations, though, are also welcome?
Absolutely, yes. We have developed an expertise serving the Hispanic population and other immigrants, but our doors are open for anyone who needs care. Part of our mantra is that we only ask what service you need, and then we determine if we have the expertise to help you with that. And if not, we do our best to provide a warm referral to another organization that's better placed to provide a response to the need in the community.
Gotcha. That's very helpful. How did it get its start?
CASA emerged, if you will, from the ashes of an organization, a nonprofit based in the Hispanic neighborhood in the city of Cherokee called La Clínica, which in Spanish means the clinic, and really took all of the lessons learned from that nonprofit and tried to leverage those and build an organization with a little bit more sustainability. So kind of taking everything that did work and didn't work and trying to imagine a better way of providing service, because it was always very much evident to those who supported the organization that there was a need for that type of service. But the question was, how do we do this sustainably, and how do we do this in a way in which we are integrating with our other partners and collaborators in the region so that we are extending, if you will, the bridge of services across marginalized populations, regardless of their walk of life.
Gotcha. So the key sounds like the partnership is what you're really trying to focus on here, right?
Absolutely, yes.
And you yourself, you came, I understand, from the International Institute. So how caused you to make the switch?
I did. I would say that there were three themes in my own personal walk of life that really interested me in coming to CASA. The first was a very personal story. When my family came in the mid-'70s, prior to the Refugee Act, so in fact we were asylees because there was no other way to come to the States seeking refuge. My parents, right after arriving, had a really scary moment with my brother, and I was old enough to remember that moment and just remember the frustration of trying to navigate a completely new and immense healthcare system while trying to do this in a language that isn't one's preferred language. And I've carried that with me for a very long time. So when the job at CASA came up, to me, it was a very compelling way and opportunity to continue my service, my way of paying forward and paying back to all those who gave opportunities to me and my family so that we could be in this very position. The second trend, I think, or life event that really shaped me and made this opportunity one that I was very excited to take up was that about mid-career, I had the opportunity to go to Equatorial Guinea, which is a little country in Africa, the only Spanish colony in Africa, to work on a malaria prevention project, or a prevention and reduction project. And my job was to go out into the community and talk to people and hear from them how they thought the project was going, what their frustrations were, what was going well. And so I really got a firsthand account of how difficult it is to provide care to a community that's really struggling across many levels, not just in the healthcare space. And I realized the interconnectedness of the holistic nature of people's lives, and trying to provide care in a way that is that acknowledges that complexity was something I also carried. And I thought that CASA did a very good job of acknowledging and trying to respond. And this gets back to the theme of partnership and collaboration. And then finally, and most recently, while at the International Institute, one of the things that really struck me as I was working in the immigrant entrepreneurial space is that we had tremendous talent, passion, uniqueness in the entrepreneurs that I was helping start and strengthen their business. But I also noticed that a sort of recurring theme in terms of the challenges and shocks that would likely lead to a initial failure, because it's not about the failings, it's about how many times you get up and try it again.
Sure.
One of the things that really led to those initial failures and shocks were shocks to the healthcare and the health of the families of the people that we were trying to help. And so to me, it was a very natural transition to go from the entrepreneurial space and productivity into the space of healthcare, which leads to a more wholesome and productive life, both at home in the community and also in our contributions to the economy.
That's fantastic. Yeah, that makes a lot of sense, because a lot of folks, who do try to strike out on their own, that's a major barrier, is that lack
Absolutely.
of insurance. So it sounds as though you've got a pretty robust network of connections. Is that am I reading it right? How might people in your target audience hear about CASA, and what kind of outreach are you doing in the community?
Yeah, absolutely. So like many nonprofits and small nonprofits at that, we really rely on word of mouth as our most powerful, most efficient and effective way to message about our services. So one excellent experience here at CASA on behalf of a patient or a client leads to many more people calling and wanting to know more about how we may be able to help them. And so that's really slowly and intentionally how CASA grew through the beginning of its existence. Now, once we got on our feet around 5 years into our service provision, we began to also interact with the broader safety net system and starting to collaborate with regional hospitals and federally qualified healthcare centers and other immigrant service providing networks, so that we could coordinate our services and we could utilize our strengths and support each other in our weaknesses, if you will. And so I think about this, oftentimes we use this word safety net, and every time I use it, I try to sort of pull up a mental image of, well, who's holding that safety net, right? It's a collaboration of organizations and people behind those organizations physically holding that safety net taut so people can be safe. And we think about that a lot when we interact in the community, and finding ways to stay connected, stay in front of each other as organizations, and make sure that we're making the best, warmest, most successful referrals, because we're not set up, and many nonprofits in the region are not set up to do it all, but rather to do one or two things really, really well. And that's something that we hold ourselves to a very high standard in doing that, and doing a couple of things very well, and then being really good at referring people to other organizations that align with that ethos, if you will.
I feel like it's such a complicated system that a great deal of handholding can be necessary, just in any for any walk of life. Trying to access healthcare can be a bit of a challenge. So it's really good that there is that network that exists to kind of carry people along. But walk us through what that process looks like. So somebody comes to you, they have a health condition, they're uninsured. What might they experience as they interact with you?
Right. So we very much hold ourselves to the standard of access, and we ask ourselves every day, what does access look like for us in the way that we provide services, and what does it feel like for the patient and the client? That's the most important part of the dynamic, right? What is their journey through the organization? And so it really starts with not talking, but rather listening and hearing out what someone is calling us for. And once we have the information, if we have the expertise here at CASA to help them, then the next question is, when can we get you in? When can we see you? When can we get you in front of the right professional to help you address the issue that you might need help with addressing? And once patients come in, once we have a patient sort of identified, we also make sure that we're putting together a team that is ready to receive that patient and is culturally and linguistically prepared to do that, so that when the patient walks in, we're reducing a lot of sort of the built-in friction in our healthcare system. We have a very large, very structured, very rigid healthcare system that provides a lot of really great quality care, cutting-edge care. The development of the coronavirus vaccines, I will say, carry this to my grave, was probably one of the greater contributions to mankind that the U.S. Will ever have been able to be a part of. And I think that's part of this strong healthcare system. But the downside to that is that it is very structured and rigid. And so there is very little flexibility for folks who bring a different walk of life into the system. The presumption is you adjust to the system can't adjust to you. CASA does it the exact opposite. We adjust to the walk of life, and then we provide a lot of follow-on care so that patients who do need to sort of cross the bridge into the wider healthcare system, and most of them do, understand what's waiting for them at the other side of the bridge, and carry with them tools to advocate for their rights and the way that they have every right to be served with dignity, but also understanding that it is sort of a duality, it's a dialogue. There are some responsibilities that are required of anybody who is accessing the healthcare system in the United States. And I do think that that's necessary for the types of successes that we can generate in our healthcare system. So it really is about listening and about accompanying and walking with people along their healthcare journey until they're in a place where they're able to take that into their own control and be their own best advocates, and ensure that that they've sort of built up the habits to take care of their health and wellness, and they can be productive moving forward.
You mentioned the development of the vaccine for the pandemic, which calls to mind what so many people experienced and the stresses on people's lives that the pandemic created. How has the pandemic affected your services?
Yeah, it's interesting. We feel here at Casa like we're at somewhat of a reflexive point. We can look back, something I couldn't have said maybe even a few months ago.
Sure.
And I can say now that I think that the pandemic obviously, and not surprisingly, affected us tremendously, but at the same time, it didn't affect us at all. And that's because we quickly transitioned in March of 2020 to telehealth and digital means of providing services. And we put that out there to our patients and our clients, and we asked them to believe in us, because it was a huge leap from in-person, I can feel you, I can touch you, I can see you service, to I'm on the other end of this, digital conversation, and you've got to trust that I'm still me and you're still you. But patients, luckily, because of our track record, were willing to give us that grace, and we were able to then show them that this was a means to an end, right? This was a temporary solution for a problem we hope that we could solve fairly quickly. And I think, again, in the United States, we've done a fairly good job in retrospect of at least getting the vaccine developed and deployed. But one of the good examples of how we've had to iterate this idea of service provision throughout the pandemic, which has evolved consistently since we heard about it really in January of 2020, is that initially we thought that telehealth would be a great bridge between providing services during the pandemic and in-person or pre-pandemic services. And what we found is the digital tools that we had were great tools, but they also sort of presented other barriers that we hadn't thought about, such as the barrier to accessing internet, the barrier to having the right type of equipment, of having a good, safe, quiet place to engage in a telehealth engagement, whether it's clinical or behavioral health.
Sure.
And so we iterated and we created what we call the hybrid teleclinic, and made use of our, at the time, empty clinic rooms. And we invited clients to come to Casa. We screened them for COVID. We provided them masks, and then they could sit in the clinic in a very private environment with a laptop, with a high definition camera and the internet, and they could connect with a provider from Casa, which ironically means home, right?
Yeah,
So
right.
We like to joke they were at home connecting with their provider. And we added to this the ability of having our medical assistants on site, so that if a doctor said, you know what, I really want to take your blood pressure right now, I think that's the next step, they could actually do that. Imagine if you're at home and you're asked to do that and you don't have a blood pressure cuff, then the engagement ends. And there's a high likelihood that you don't take that next step, and things could get worse. And so we're very proud of that iteration, and we got great response both from patients and doctors, because they felt that we had really looked at the problem and looked at possible solutions and tried something new and demonstrated that it could work for our community.
That's fantastic. So what does the future hold, do you think?
I think the future is still slightly, there's a lot of uncertainty still. I wish I could feel more confident about what the future holds, but I think that we have done a very good job, especially regionally, of staying connected to the diverse population, of providing information in multiple languages, of thinking about designing and deploying vaccination events in a multilingual, multicultural way from the get-go, which is something that we haven't seen in other communities. And you've seen the data now, where the Hispanic community and even the Black community in St. Louis right now are growing at the fastest rate in terms of access to vaccines. I think that that's a result of a lot of hard work over several months to convince folks through the design and the deployment of these activities that we really do care about their well-being, and this is something that's been designed with them in mind, not just designed and then plopped upon them. And so I think that there's a lot of work that we still need to do with that, and that's what's creating the uncertainty. We need to raise the rate of vaccinations before we can think about what the post-pandemic life looks like. And I've said this several times, and another, I think, thing I will carry to my grave is that ending the pandemic is only the beginning of the healing process. The pandemic has put so many things on hold, has compromised so many parts of our personal lives, all of us really, not just the folks that we serve, and untangling that and addressing all of those things that had to be put on hold for the better and the good of the community now have to be addressed. And there isn't the capacity in the community to do that in a way that meets the demand that's in the community today. So we will be spending, I think, the next 12 to 24 months sort of clawing back all of that delay in care and helping people really get back to being in a habit of being healthy so that they can be again well and productive.
Seems a good place to call an end to it, but I'm going to put a link to Casa de Salud in the notes to this, and we'll post it up on our YouTube channel. So thank you so much, Diego, for taking the time today. I really appreciate it.
Pleasure. Thank you very much for inviting me on.